Ozempic, the most popular solution for weight loss lately. Let's talk about it. Its active ingredient is semaglutide that belongs to a class of antidiabetic drugs called GLP-1 receptor agonists, or the glucagon-like peptide-1 receptor agonists. It's primarily used to regulate blood sugar levels. Although it's not FDA approved for weight loss, it's being prescribed off-label for weight loss. Why? Because of its effect on appetite suppression. It targets the brain's appetite center and acts on the GLP-1 receptors in the hypothalamus, which is the brain region responsible for regulating hunger and satiety. This decreases appetite and reduces food intake. In addition, it increases satiety. It enhances the feeling of fullness after eating, so it helps individuals consume smaller portions and reduce snacking. In addition, it slows gastric emptying, so it delays stomach emptying and slows the passage of food from the stomach to the small intestine. This prolongs the feeling of fullness after a meal and prevents rapid blood sugar spikes, which can trigger hunger. How much weight would you lose when you're using Ozempic? Of course, the weight loss effect is dose dependent and more pronounced when combined with lifestyle changes like diet and exercises. However, in a study of non-diabetic, overweight, or obese adults, semaglutide led to an average weight loss of 15 to 20% of the body weight over 68 weeks. Can anyone who wants to lose weight just go and buy Ozempic? Of course not. There's a specific criteria for that. First, you need to measure your body mass index, also known as BMI. There's online calculators that can do it for you. So if this BMI is equal or more than 30, then you count as an obese and it might be reasonable to use Ozempic. Or if your BMI is equal or more than 27, you are considered overweight and you have at least one weight-related condition such as hypertension, type 2 diabetes, or dyslipidemia, then you're more likely to benefit from Ozempic. In addition, Ozempic is most likely to benefit people with already existing diabetes. In addition, an important note that the patient needs to know that Ozempic works best when combined with lifestyle changes. So the patient needs to follow a reduced calorie diet as recommended and do a physical activity to aim for at least 150 minutes of moderate exercise weekly, such as cycling, swimming, or brisk walking. Also, an important thing to tell the patient is that it's going to be a challenge because there is significant weight regain has been reported after stopping Ozempic, especially in individuals who did not implement lasting lifestyle change. How is it administered? It is administered subcutaneously to the abdomen, thigh, or upper arm. It's administered once weekly on the same day each week at any time of the day with or without meals. It's advised to use a different injection site each week when injecting in the same body region. You need to visually inspect before use. Drug should appear clear and colorless. Do not use if particulate matter and coloration is observed. If you are using along with insulin, make sure do not mix the products together and administer as separate injections. At what dose it's recommended to start? It's start 0.25 milligrams subcutaneously once a week for 4 weeks initially, then increase to 0.5 milligram once weekly, and then after 4 weeks you can increase to 1 milligram per week, and then after other 4 weeks you can increase to 2 milligram per week, but not to exceed these 2 milligrams per week. How to store it? If it's still unused, refrigerate it. However, do not freeze it. After first subcutaneous use, you can store it either at room temperature or at the refrigerator, and of course do not freeze, and after opening it will last 56 days, and then after these 56 days you need to discard it. An important thing you need to know is that it's contraindicated and it's not for use in patients with history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2. There are many post-marketing issues that made a dilemma whether or not Ozempic should be used for weight loss. What are they? Pulmonary aspiration, GLP-1 agonists, delay gastric emptying. There have been rare post-marketing reports of pulmonary aspiration in patients receiving GLP-1 receptor agonists undergoing elective surgeries or procedures requiring general anesthesia or deep sedation who had residual gastric continence despite reported adherence to preoperative fasting recommendation. In addition, acute pancreatitis, there is a limited experience from clinical trials in patients with a history of pancreatitis. Unknown if patients with history of pancreatitis are at higher risk for development of pancreatitis when receiving therapy. Suicidal behavior and ideation, weight regain after discontinuation. It can pose you at a risk for hypoglycemia, pancreatitis, and gallbladder stones. So, in conclusion, while Ozempic can support weight loss, it is not a magical pill and should not be used casually or as a first line weight management tool. Lifestyle modifications like a balanced diet, regular exercise, and behavioral therapy remain the cornerstone of sustainable weight management. Medications like Wegovy and Mounjaro, which are FDA approved, however not supported in many countries, might be a better option, specifically designed for weight loss, are safer and more appropriate alternatives for eligible individuals after fulfilling the criteria.